Hello, I'm Simon Eccles. I'm the Medical Director for NHS Connecting for Health, and I'm an A&E consultant in Hackney. The Clinical Dashboards programme is of real benefit to both patients and the clinicians caring for them by providing information that wouldn't easily be accessible otherwise in real time to those delivering the care. So just to explain that a bit, we've got lots and lots of information in the NHS about quality of care that we're providing, but it tends to be 3 months, 6 months, sometimes even a year behind times, and it tends to be locked in silos. So hospitals will have their own information and GPs will have their own information. What we've tried to do with the Dashboards programme is to bring all of that together with appropriate safeguards so that a team can see all aspects of the quality of care they're providing, and that allows them to change what they're doing to improve their quality. In a really acute setting like emergency medicine, the dashboards are a means of helping people get information really quickly and in a very visually easy way that they might have been able to get otherwise, but not nearly so real time. Let me give you an example. In our Homerton emergency dashboard, we've got access to blood tests, how fast they're getting back, the results are getting back to the department, the same for x-rays, and how fast we're able to turn ambulances round and get them back out onto the road. So you bring those together. If any of those are going wrong, when you look at the department, if you're just running the department, it won't be obvious. You can't see that things are running slowly. On the other hand, by using the dashboard, we can actually tell in advance of it becoming obvious to us by any normal means that it will be a problem in an hour's time or half an hour's time. So it allows us to change what we're doing or find out the reasons for the delays way ahead of it normally becoming clear to us that there was a problem. And that makes the whole thing more efficient. The dashboards themselves are just a tool. So how they're used in any individual setting, how they're adapted for one particular team, really depends on that team themselves. The dashboards don't come with answers, they're just a means of bringing information together. If it's information you've already got and is very easy to get hold of day by day, you probably don't need a dashboard to look at it. But if it's very hard to get, or it's very time consuming to acquire, and you need to spread it much more widely than you normally would, dashboards are the right answer to that. Clinical dashboards as a subject is not essentially something you just write in and say, please can I have one? It's a tool that requires quite some effort on the part of the organisation to adapt and tailor to local use. So clinicians need to talk to the whole of their clinical team and to the management of that team in order to work out whether this is the right tool for them. We've produced some guidance on our website to help people check that and to do a sort of assessment of how much value the dashboard concept may deliver for them. They're relatively pricey to put in, but they offer extremely good value for money in some care settings, and so that balance needs to be worked out by one individual team. What I'm nervous of is some people seeing them as the panacea to all their ills. They're not designed to be a performance management tool to help make clinicians more efficient. They're a clinical tool to help a team improve its quality of care. The essence of the dashboards thing is visually easy to understand, quick access to information you can get from somewhere. So if the information on the dashboard is stuff that you can get really easily and only changes once every 6 months, a dashboard isn't a way of displaying that. On the other hand, if it's information that changes really quite quickly, that the speed with which you need to make decisions about it is faster than the normal time it takes to get that information, and you want a whole team of people to see stuff that they wouldn't have otherwise been able to look at, the dashboard's the right answer. So a really good example of that is in a theatre suite where they were using the dashboards to help improve the quality of care they were providing and the turnover of patients in theatres. So trying to unblock all the little delays by putting that information publicly out in the corridor for everybody involved in the team to see. Lots of people who wouldn't have otherwise realised that they were a rate limiting step on patient care and were causing delays that were very distressing for patients. They got really involved, and that made an enormous difference to care. That's when the technology is the right answer.